2024, and this is the first meeting of the year for the Yarmouth Board of Health. Just reminder for us on the board, public, what our mission is, and that's to maintain, improve the health of everyone in Yarmouth, whether they're living here, visiting, driving through, walking through, cycling through. Part of the mission is also maintaining, improving the health of the environment. So why don't we go right to the next item, which usually is attendance. Eric.
Present.
Mary.
Present.
Larry.
Present.
Hillard here. Charlie. Not here. Okay, we have quorum here. So just a reminder, this is a hybrid participation meeting, and that means if someone is not present here, they certainly can tune right in via Zoom. They can call in. All those instructions are presently on the town website. Okay. Public comment as usual is up first. Let me know if anyone in the audience has a hand up or anyone who's zooming in. Just let me know if we have any hands up. Anybody see anyone out there? No, I don't. Fair enough. Okay. Second item on the agenda is a discussion, and that's about the Cape Cod Convenience Store located at 50 Long Pond Drive, South Yarmouth. And basically it's saying the tobacco product sales license dash, it's Ms. DeVito, owner. And I guess we need sort of an update in our packet. I'm sure you all had a chance to look at it. There's a whole timeline there of since 2021 through 2024 about some issues about the license for that location, I guess.
Thank you. If I can just
Yeah,
give you a little bit of update.
here.
You've got the chronology of this facility. As you know, tobacco permits expire at the last day of each calendar year. And unfortunately, the owner, it's been very poor communication. Responsiveness has been poor. I'm putting this in front of you so that with plenty of time, the next meeting would be the beginning of part of February. We'll notify with plenty of notification that she would be here. Tonight is not for you to take action, but you need to be aware that there's been a tobacco permit on the shelf for almost 2 years now, right? Not inactive, without a location to work off of. And you can see in your regulations that quite frankly, applications have to be put in, but they're supposed to be active. And you have 29 permits here in town. You've set that limit by board policy, right? That if they do not put in the application, this is interesting. They have put in the application. They just don't have a facility or an establishment to work out of. So that's going to be a discussion. My hope is that the permit holder, Stephanie DeVito, I believe will be here at your next meeting to discuss what her plans are. But it's been close to 2 years now, and the permit has been set vacant. It's just set aside, and there's no facility to work out of. So we have 28 active licenses, and she's put in an application for 24, but she has no place to work out of.
Has she paid the fee?
She's paid the fee. Each year she's paid the fee.
Each year.
But it is truly in a category of inactive license.
Right.
Mary, do you recall? I don't think we've seen this before.
We haven't. And I mean, the way the regulation reads, any permit holder who has failed to renew their permit, and she has renewed the permit and she has paid the fee. Now, we don't say that's not all you have to do. You have to have an inspection.
Exactly. That's when you say renewed. Really, we didn't issue a 22 or a 23. There was no inspection could be done.
So you don't issue a license without an inspection.
Exactly right.
So we probably need to put that in here, I think. That's my comment on that.
Does the board know why she hasn't had it. Do you know the backstory?
Yeah.
Because of the
yeah,
fire?
It's in the timeline about
Yeah,
the
okay.
fire and then the,
Okay, I was
right.
making sure.
So I
saw
mean,
that too.
it's understandable. I mean, I didn't.
Yeah.
You know, I certainly can understand, and it's a valuable thing to have if she's at some point going to reopen a store, but continuing to just kind of hold it out there. And like you said, if she's not being really forthcoming with
That-
you all, that doesn't help us either to kind of look at the situation and say, you know,
I can't even provide guidance for the board to say, there's been very, lack of, and Phil has tried, lack of communication through email, visiting, phone calls. It's been a one-way conversation and we're not getting any response. So I can't even provide the board guidance as to, well, this is what she's planning.
Right.
The best we can do next is to invite her in, plenty of time, almost a month
right.
to come in. And, again, the board's going to have to make a decision if I don't want to suppose, but if the scenario is that she doesn't come up at that meeting, I would put that on as a hearing to have a discussion, to have a vote on that.
I think that's more than fair.
Sure. So someone is sitting with a license, basically, and not using it.
Well, she actually
Doesn't have a
She doesn't
license.
The application in, but
has an
doesn't
application
physically
in,
have
but we
it.
can't issue, it's like someone putting in for a restaurant application.
Right.
We can't issue that permit, and we haven't for 2 years
Without an inspection.
without an inspection. So signage and all the parameters that go along with the requirements of having a valid posting your permit, all those pieces are not in place. It is rare. Don't get me, I don't know that I've ever seen this to sit.
Yeah.
Haven't seen this
Yeah,
before.
even to say, listen, I'm in the process of a sale. I'm looking for another location. Something that would give you an understanding of 6 more months, 3 more months. This is my new location. I'm opening up at the old location. I have none of that information.
So at this
Right.
point, she doesn't even have a license to sell.
She does not, it's pending that, but now we have done, no, she's right. She has an application in.
But
Okay,
she
nothing has
doesn't
been
have a
issued.
permit or a license.
That's true.
So she's got nothing of value if she doesn't come up with a location.
Well, one of the things also though would be, is there a time limit or not? Can someone sit on it for 10 years or
Well,
not?
we don't address it.
That-
Right.
That's not, it's never.
It's
come
never,
up.
it's not come up, but yeah, we don't address it.
That's what the discussion at some point.
Can a permit sit inactive for X amount of time? I don't,
I mean, and the thing is, we know that there are people out there that would love to have a permit, so she kind of missed an opportunity to maybe at least make something off of this, but right now she either opens up a location and gets it inspected, or
Right.
she's out of luck. Unless, I mean, we haven't discussed it all. I know that, but I mean, should be the scenario.
Yeah. So the bottom line is going to be, we have to decide whether she's entitled to have one or not at this point.
well, my hope would be
After
when she comes,
in.
Yeah.
and say,
Yeah.
why has this taken so
Yeah.
long?
Right.
And I just don't, but if she were to come to appear before you and give an explanation, I think that will put some of the pieces and connect some of the dots for you. And from that information, you can then make an informed decision.
And we frequently do give time limits when we make a decision. So
Right.
we could at that point say, this is how long.
It would be a lot easier if we didn't have applications, but we have applications and that's what's interesting.
Right. If you
Yeah.
just hadn't heard from her at all, she hadn't paid anything, it would have been a little bit more cut and dried.
Right.
Yeah.
Yeah, you could take action tonight.
And if she were opening like a childcare or something, it'd be easier. But a tobacco retail store is not something we're trying to encourage anyway. So
Right.
that's beside the point.
Jay, what do you mean? You said we have applications in?
There is an application for.
Okay,
20
right,
foot.
right, right.
There's an application to issue a permit. I just can't issue it.
And I'm just thinking that this, whatever we decide, this permit would not then become available to anyone else.
Right, it would be
It would
taken
be
off.
part of the reduced.
Right.
He doesn't get it.
If she doesn't get it, right,
Yes, that's the
Yeah.
cap.
right. There's no
Just to
permit.
clarify, we have applications for this location.
Okay.
Yeah,
Yes.
and she actually
Thank
puts down this location.
And what is that location?
It's Long Pond.
Pond.
50.
Yeah, but I mean, what is there?
It's a
Is there a
strip-
store there now?
It's a small strip mall across from Stop and Shop on the right-hand side as you go. If Stop and Shop is on your left,
Yeah,
there's a small.
Oh,
a
before
strip
the
mall.
funeral home.
Exactly right.
okay.
Yep.
Yes,
Right.
And they had a fire.
right.
Okay.
Lavelle's trucks are there.
Okay.
That's where it is. Okay.
Well, I think there's two things now. Now that we're having this discussion, I appreciate this. Do we also have to, does the board need to open up the regulations as well and to look at a time frame? Should that be inserted? This is prompting something that we've never seen.
Yes, and also about saying that, and there needs to be language here that says a permit is not issued until an inspection has been successfully conducted and passed.
Right?
And then the time, if an application is made, but an inspection cannot take place within
Right.
give a certain period of time, then the permit is retired. The license is retired, or whatever, or, taken from
yeah.
the,
Yeah, or perhaps something, because maybe after a fire, depending on how significant, the
Right.
communication to the board as to what the plans are for that, because it
Well,
could take
yes.
some time.
and that unfortunately has to be in there too. You wouldn't think so, but yes, it does.
Right.
Yeah.
Some
But
leniency.
again, if it comes before us, we've always taken things into consideration.
Right.
You know,
Yeah.
I mean, there can be exceptions, there can be, variances.
Yeah, this is probably a good example. It falls under the category of good communication would help her in a significant way, would also help the board to make an informed decision.
Right. But if she comes in, hopefully that will happen. It would be very late happening, but it will at least give us a chance at that point to
Right.
look at the whole picture, because she's going to give us missing pieces.
Yeah, Phil, our inspector for restaurants and, food establishments, handles tobacco, been very frustrated in this
Yeah.
on a regular basis, been trying to chase her down. And again, just to be able to issue her permit and the communication just has been
I
non-existent.
mean, is the place open? Is this?
No,
No, okay.
No. No.
So it'll come down to a person fails to renew the permit. 30-day limit, however, there are some issues here in this particular case, for instance, like having a fire, and how do we, as a board, address that? What do we do if someone needs to rebuild or move, or how do we handle that?
We listen to it. We have them come before us. That would be I don't think we need to write something in about it. Would you come before us and talk about what's going on and
Might you even consider it? I don't know. If a permit becomes inactive for X 30 days, 60 days to notify the board, put some responsibility. I think Phil found this through the fire and what have you, but there is an obligation when you have a permit, when you permit. This is,
Right.
to this board. That
This
is,
takes too much time with someone in your department,
absolutely.
okay?
And she didn't even let him know he found out about it.
right.
Yeah, that's,
Okay, why don't we move on then?
So-
You okay moving on?
So what we need to do is just spell out for Jay what would be in the letter, I think, right? Is that right, Jay?
well,
Well,
he's got
we're
the
gonna,
letter.
My understanding is that you'd want her to come explain to us what the situation is and the consequence of her not coming in. I mean, obviously, if she's not gonna communicate with us, we have to assume that she's not interested in a license. Is that correct?
I do. And so on a fairly regular basis, we have, pretty boilerplate letters to say to appear before the board to discuss your application. So I don't think it has to be specific to this situation, but where her permit has been inactive for close to 2 years, the Board of Health is asking her to appear to give the explanation and pending and potentially, it's kind of a catchphrase at the end, potential action could be taken against your permit.
Right.
Well,
Which doesn't even exist.
Doesn't even
Against
exist,
your application.
But
Yeah.
yeah, against your application, right?
Just so you know, these permits worth a lot of money.
Yeah.
You can sell your permit.
Right. I also know though that a permit or a license, if it's not renewed, it's not incumbent on the people that are issuing the permit to chase these people down, that
Right.
if you don't
Right.
send in if you don't follow protocol, you risk surrendering your license. I would think that she needs to understand that.
Right.
That I think you're going above and beyond even at this point.
But she has submitted the applications for the last 3 years and she has paid the fee.
But she's not complying with regulations
We
too.
don't have a regulation that says you don't get a license until there's been an inspection.
Okay.
So, I mean, technically, I mean, that should be understood, but technically it's not in here.
And there's no statute of limitations to her, not right.
No, we don't have
okay.
that in there either.
So here's a case where we have a regulation, we may find out that we need to improve it, but while this is taking place,
Right,
this is the regulation.
sure,
Yeah.
And we may need to write a new regulation or whatever.
right.
Um,
Well, it wouldn't be unreasonable though to ask her to come in and tell us what
Oh,
the
no, no.
status of
Right.
her
She has to.
situation
I mean,
is.
she has to do it. 3 years is giving her a lot of leeway.
Yes,
Especially like you said, there is value to that
Yeah.
permit.
Absolutely.
So what the way I understand it, if this permit isn't renewed, that permit ceases to exist. Is that correct under our present
Yes.
right.
law?
Then we
right.
have 28.
Now,
Yeah.
can she transfer that permit herself?
Only if she gets it. And she can't
Right.
get it till she has a facility and an inspection of it.
But then she could transfer it.
Yes.
Yeah,
Yeah, once it's hers, she could do that.
you're gonna find that you're sitting on the board that people sometimes late dealing with their permits.
Yeah,
This
but-
happens quite
And the
frequently.
board's very magnanimous about understanding that.
Yes, we're very good people.
I
Yeah.
think, yeah,
We are.
basically, the staff,
ever.
and the staff gives some leeway too.
Yeah, I mean, these
Yeah.
people are in business and we want them to
Yeah.
be in business.
When we get when it comes to us, they've already given them some,
Sounds like it.
grace
No
periods.
question.
Yeah,
I mean, I couldn't imagine being in that scenario and not being anxious to comply with the regulations.
right.
Considering what's
Yeah.
at stake.
I think this is too long. This
Right.
has gone on too long, but
Right.
we can take care of that now.
I'll invite her in and hopefully at the next meeting, we can come to some determination of given how her explanation, what that will look like.
Yeah, and kind of following up on Larry said, I would say, definitively, we will be making a decision about this, I mean, let her know. We can't make you come in, but if you don't, even if you don't, we are going to be discussing it and making a decision about the status of, I don't know how you want to say it.
So you're going to make a determination on her permit, on her application.
Yes, on her application, yeah.
Yeah, new regulations is something
On the
else.
Application, right, yeah.
Okay. That will go out and actually, I know we're jumping ahead here, but it's actually February 5th, I believe is the first,
Yes, it is,
Nick.
February 5th, yeah,
is the first. We obviously missed because of the
right.
Martin Luther King.
Yeah, that's good.
She'll be asked to come in through a letter for February 5th.
Okay, third item, is a discussion on we'll be serving poultry regulation time here. Okay, so we're going to review and update possibly the poultry regulation. This obviously came about because we had a case in front of us, as you recall, dealing with a rooster. So I think we recognized that maybe it's time to look at it. The last time regulations were looked at, and it was 2017, I think. So that's up for tonight. I don't know if you want to lead things off, Jay, or.
We gave you quite a few comparison regulations, and I didn't know that you were going to actually, I think because of the compressed time frame, I don't know, although that's up to the board, if they think they can go through this, if they've had even enough time to give some kind of accurate comparison. There's state regulations in here, and then there's multiple other community regulations. Just for your comparison, I really hadn't even anticipated something where you would go over them and then vote. I didn't even put it down as a vote on the regulations. But this was more going to be backup information to give you time to, what are some of the things that some of the other communities are doing? What do the state regulations require? And then if in fact you may come to the point of the thinking of the conclusion that our regulations are fine and we continue on and we just put a new date on it, that they've been reviewed, they've been updated and modernized. But this is just to give you some comparison as to what some of the other regulations are and what the thoughts are for the board that might want. One was roosters.
Okay, if it's okay, I think we should give it some time. I mean, we need to be out of here by 20 of, is that be enough? Quarter of, what do you need? Quarter of, fine. So, on 4 through 7 seem pretty brief.
Can I make just a brief comment on that?
Yes.
Save the board some time. I looked over everything. I am, I do have quite a bit of experience with poultry housing. The regulations as they sit aren't really realistic. The setbacks have really no scientific or medical basis. I'm not sure how they were arrived at. I did look over the other ones and my thought was that possibly I could meet with Barry between now and when we want to discuss this further, come up with some reasonable regulations and present it to the board. That would, and then, have the regulations consistent with, practical application.
That
That
sounds
would
great.
be
Okay,
acceptable.
Yeah.
that would be great.
Is that okay with you?
100%, sir. Yeah, I would like to, myself and Phil, the three of us sit down and
Sure.
discuss and go over what, with your expertise would be
Thought
great.
Plymouth's regulations were pretty reasonable.
Yeah.
So, I mean, we can start and I could present, my opinion and we can go from there if you'd like.
That'd be great. Yeah, I appreciate having the examples from the other towns. That was really helpful to look at things that they have and we don't, and just realize maybe we should or maybe we should not. But I found that very educational to look at the other towns. Yeah, I agree about Plymouth with you.
I think it's important to understand there really is very, very minimal risk, public health to keeping backyard poultry. And keeping pigeons, minimal risk. So from that basis, I was going to try to formulate a reasonable docket of regulations.
I think, if I could just
Yeah.
to be with some of the questions we have, thank you for becoming the poultry subcommittee. But on the setbacks, that's now we're protecting, it's a little bit of buffer for neighbors and things of that nature. So that has to be taken into consideration because some of the complaints we get, our neighbors will ask about, and not necessarily poultry, but a number of different things. It
Yeah.
could be anything as benign as a shed to a swimming pool, to a septic system that's going on. And neighbors are very cognizant of encroachment. They may have a vegetable garden on the other side of a septic system. The board has seen a whole host of things. So when you're looking at that, you're not only is the individual and the risk, but also then the abutters. And I think the opening comments about the environment. So
My thoughts along those lines, I understand that. My thoughts were, and we can discuss this further, is typically a shed would require building permit or inspection by the building department, possibly a committee like the Historical Society, that sort of thing.
zoning, yeah.
Those are regulations that would be beyond the scope of what we do. But so they would be part of I think the application process for license. I think the people would have to comply with building zoning regulations and
Wetlands or whatever.
wetlands, Historical Society, that sort of thing.
Right.
Yeah. So we'd have to take all that into consideration. I realize that.
Okay, yeah. I know I think you might have come in on the tail end. I know the board wrestled with something for 2 to 3 years and it was on a horse, on a stable.
Yeah.
Again, I don't know if they're analogous or not.
Well, not
But-
quite.
Right.
I think that's a different scenario than a few backyard chickens.
The only reason I bring up that as an example because of the disruption in the neighborhood
Sure.
and the difficulty that caused. So
Yeah.
be cognizant of not only the individual and the homeowner and their right in balancing their rights with the abutters
Yeah.
and any concern that it may
Sure.
cause.
And one of the things just I think to keep in mind is important, and that is not to expect residents to have to figure out the state regs or have to go to
Right,
them. I
sure.
mean, we're not punishing people.
Exactly.
They're complicated,
Right now,
so
it's it looks, if a person had a typical house lot, it'd be almost impossible to have a poultry to raise 10 chickens or 12 chickens to
Right.
have eggs.
Yep.
So I really think it needs to be more reasonable, in my opinion.
that's great.
Especially these days,
Pardon?
especially these days.
Well, it's a good family project as well.
Yeah, good
Yeah.
point. Anything else on poultry? Anyone? Okay,
So just so I'm clear, you're going to meet?
That's acceptable to Barry.
Yep, 100%. I'll reach out to you tomorrow to get a tentative date. We can
Sure.
meet at your shop.
Sure, great. I did go on the Veterinary Information Network and did a little research on the zoonotic diseases associated with chickens and was really pretty much nothing.
And that'd be good to be able to cite too.
Yeah,
Because
sure.
when you do that, you
Yep.
know, people that
We'll,
are
we'll
going to
make sure we prepare, do our research.
scholarly paper.
it's salmonella, is that what it is?
Salmonella is very, very, very minimal risk.
Yeah,
Your little pet turtle is a lot more of a risk.
Yeah, who should handle that?
And then,
And that again is probably a minimal risk.
well, we'll deal with
That's another.
turtle regs another day, but anyway, so let's go to update number 4. And that's on the migrant family site over at Harborside Suites in South Yarmouth. So I need someone to speak up here from the health department.
well, I'm going to go back a little bit on that I very much appreciate, we got some significant feedback of, from the 3-month update that the board held a hearing, this room, not full, but we had attendees, probably more than a dozen. And it was very informative for the community. I think a lot of things were able to be ironed out as far as what the 3-month process has been. I just want you to know, we did receive some very positive
Good.
emails and phone calls to the health office, complimentary to all of you, that you took the time to hold a 3-month update
That's
about the
great.
migrant. Yeah, that was very good.
You coordinated it and thank you.
So one of the things that came up, actually, I attended the selectmen's meeting the night after. And it was, again, some of the questions that you had answered were repeated again the next night. And I don't know if any of you saw that. But about that the board hasn't, or the town hasn't been communicating, and they're waiting 3 weeks before the information gets out and things of that nature. And I did speak at the selectmen's meeting in the public comment to simply say that's just factually inaccurate. That the board, since the migrant program came, and again, over 90 municipalities participate, the board, each and every, and to include tonight, what we're doing right now, there's been an update on the migrant program. So that, but again, sometimes misinformation and misinforming has become problematic with this. And again, we're dealing with imperfect information on a regular basis. We don't have all the information. It's certainly not timely. And then the other piece being, there are 2 other issues regarding a crosswalk. I think you heard about that. Well, quite frankly, your board, you folks have a lot of authority, but putting a crosswalk across a state road is not within your scope. It's just not. And then also was kids playing. Well, we addressed that. There's not a lot of green space. It's unfortunate for those children to play. But we addressed that back in September. We reinforced it with the National Guard as far as protecting and things of that nature. Now we're into December, so it's not the case. But we had the Board of Health was well aware of those issues, the safety. They were kicking a ball, they're riding their bikes, making sure it was safe and away from busy Route 28. But the takeaway from that meeting, and I know I'm kind of encapsulating what happened at your last meeting, was that all the fear and anxiety is a highly charged issue.
Mhm.
There were no communicable diseases. To this day, there are no communicable diseases there. The school system has not been disrupted. That small cohort of 28 students have seamlessly integrated into the school system, and the public safety has not been a major strain. There's been 2 calls, and one was a child had fallen down. So all the fear and anxiety that was from 3 months ago has not been realized. And I think Yarmouth, and I said this at the selectmen's meeting, should be very proud, quite frankly, and as a matter of fact, at that meeting, a woman stepped forward with some books and some donations. We continue to get those. Christmas meals were dropped off. There's over 100 Christmas meals were dropped off. There's been a tremendous outpouring of philanthropy and charity for the migrants. So to that community, and they're sincerely appreciative. But when Barry goes over and he can chime in on some of this, he works with the National Guard on a regular basis. The individuals are saying this is a really well-run program. It's not perfect. It's an emergency shelter, right? This is not housing first. It's very, very difficult. They're living in a 12 by 15 room with a family. Very, very difficult. But with what we have here in Yarmouth, it's working. Now, in saying that, and then I'll give you a report of where we stand today. The state does have a consolidation plan, right? They're consolidating, you probably read about this. They're consolidating some of the non-supportive. We're non-supported. We don't have, we don't really have a facility or a healthcare institution that's taking this over or monitoring this. So we weren't on the December consolidation plan, and we weren't in the January consolidation plan. But I don't know. I don't want to create any expectations for the board or for the community to understand that, well, gee, maybe they're going to be relocating. That's not the case at all. But there is an overarching strategy from the state to consolidate these, like I said, over 90 sites to bring them into a more organized and supported service with wraparound services to help these individuals thrive. Happened with Bourne, exactly. They were there. So I think it happened maybe with some of Plymouth as well. But to where we stand, so that meeting, although, sometimes it was difficult, but the state, the docs came in and they were able to hopefully, I know that it's difficult, but that latent tuberculosis versus active tuberculosis. And Mary, to your comments, because I talked to them afterwards, you were spot on as far as to simply say, it is difficult. We had, and I was cited an example of a doctor saying they had a woman who was active tuberculosis sleeping in the bed with her husband and her child, and neither one tested positive. Now that's anecdotal, but it illustrates your point to say this isn't walking by or someone sneezing or coughing. So your infectious disease control background that you articulated at that last meeting was exactly right. And the doctors confirmed exactly that in my follow-up conversations. So thank you. And each of you participated on that meeting, and I really appreciate that. So at the last report, we had 115 residents. Today, well, actually, it was when this report was written back on Friday, there was 111. As we sit today, it's one less. A woman has been transferred, expecting to deliver up in Boston. So it would be 110 individuals living at the migrant facility. That's 35 rooms, families. The reason it went down, they wanted to move closer to their family in Boston, right? So there is some transition and there's some fluidity and flexibility in that, all within the system itself. They moved to another shelter, but they're moving in that direction. Again, the National Guard, and Barry, I'll turn this over to you. They reported that no illnesses, donations are coming in on a regular basis, and Barry checks as far as the dumpster and the facilities itself. Barry, I don't know if you want to talk a little bit.
When the books were donated, when I dropped them off on Friday, I went in. It was right at a little after lunchtime. I walked into the main lobby, and there was a group of probably 15 to 20 adults and children that were studying English, and there was 4 or 5 volunteers there helping them out. And the books that were donated, they were Creole to English and English to Creole books, the lady just looked at me. She's like, she recognized me at first. I had to introduce myself. very, very thankful for what we were doing. And they were all just there studying and smiling and very happy with it. I did reach out to the National Guard and no issues going on over the holidays. Everything was nice and calm and quiet, very normal day to day over at the Harborside Suites. So
No issue with heat or anything in the rooms? I mean, it's getting cold out there. Anything about the physical plant there?
I'm glad so it came to our attention just prior to this meeting that early this
an
morning,
hour ago,
a room was flooded. So we don't have, I didn't receive anything from the fire department who did respond, but it was literally today. And Barry will get information tomorrow on that, but it isn't that we're not aware of it. We just don't have enough detail to inform you on that. But so to say it was a sewer backup to a water pipe that broke to something, a mishap happened internally, I don't know. We're fully aware. So the community understands, we are aware there was a disruption there for one room, and we're going to have the details, and I'll get them to you, and I'll be able to report that. But the flooded room was the 8th, and that is today. I just don't have I didn't go over there today. I try to go over there every couple of days.
Just let me know about where the family is, what's going on. Just.
I'll find out all that
When you find it
tomorrow.
out,
I'll
let
find
me know.
out.
Just send me
Yeah.
an email or something.
And with one family being already moved to Boston, that opened up a room, so they might have just transported them to another room. Not 100% for sure, but
Okay.
again, I will go and talk to my people tomorrow over there. So
Okay, great.
And if there are contractors that had to come to do repair, we'll find out all of those information. It might have been cold weather. I don't know.
could have been a bathtub. It could have been
Yeah.
a clogged toilet. We don't have enough information.
Okay.
It literally just happened. So, but we are aware of it.
Okay.
So we heard from the manager via the teleconference last meeting, who's on site, correct?
She is actually works for the state. She's called the state coordinator.
Okay,
So not only does she doesn't live there, but there is a manager that lives 24/7 there.
that's what I'm talking about.
That was not the woman that you saw on the site. On the,
Women, the state person and then the site manager.
yeah, neither one of them actually. Those are state employees. She doesn't live there.
The
You're
state
Danielle.
employee does not live there now.
No.
But she
But she's there when?
during the days, during lunchtime, distributing lunch meals and taking the meals and making sure they're distributed evenly throughout the.
So she's there during the day.
She is.
And the motel owner, is she ever on site?
Yes, they're like every time I go by,
There.
I don't know, they must have cameras everywhere because as soon as I go in, like when I dropped off the books, I said hi and when I was leaving, they came out. They're like, "Is everything all right? Can we help you with anything?" I was like, "No, I'm just dropping off books," and they know who I am. So
Right.
when I'm there, they come find me
Okay.
very quickly, very easily. So
So they've been very responsive.
yeah, they're
Yeah.
anytime I need anything, if noticing like with dumpsters or anything like that, they're on it for me. So
Okay, good. Nice to hear some good news about migrants
Again,
and how they're taken in.
it's an emergency shelter. I don't want to escalate or overstate the program. It's difficult. I've been dealing with homelessness for a long time. This isn't a housing first program with wraparound services.
Right.
We're sheltering people until a better program comes in.
Okay. Anyone?
Thanks for the update.
Sure. Yep. But I hope the board does understand. I'm just reiterating, you were complimented, the whole board was complimented to provide a 3-month update. And I think the community really appreciates information because with that, they have a strong understanding of what goes on.
Okay, number 5 here on the agenda is an update on the coronavirus. So it's
That'd be nice,
Barry.
sir.
Thank you.
thank you, Mr. Chair. So here in Yarmouth from 12/3 to 12/30, Yarmouth was at 14.77% positivity rate with 110 positive results. That's a little bit higher than the county and about 2% higher than the state positivity rate. The last 2 weeks, 12/17 through 12/30, Yarmouth was at 18.42% positivity rate with 60 positives. The county was at 16.79 and the state was at 14.39. So Yarmouth is a little bit higher than the county and the state. And then last week with the 12/24 through 12/30, right at the holiday season, Yarmouth was at 21.18 with the positivity rate and at 31 positive cases. This has been a trend for the last 4 or 5 years over the holidays. It has gone up. So I was online earlier on the Mass DPH site. If people would like test, I have a website right here. I'll give it to you twice. It's bit.ly/COVID test request MA. So once again, that's bit.ly/COVID test request MA. You can go online, the community can go online and request some tests.
We get that on the website?
I'd be more than happy to
Yeah.
get that
be
put up
easier
there.
for people.
Yeah, I just looked it up this afternoon, so.
Great.
And then just over the state, last week, December 24th to December 30th, statewide, there was 479 confirmed COVID cases with about 1,100 probable cases. And then, so again, we saw that peak right around the holiday season, and it should be going down again after the holidays with the groups gathering and everything like that. So
How are the hospitals doing? How's Cape Cod Hospital doing?
I do not have that information in front of me. I got ages like by state. The highest rates for people that get COVID are between 50 and 79. They're the most susceptible right now. That's typical. The lowest are the children less than 5 years, and then 5 to 19 is the second lowest age group to be getting it right now. So, just some basic guidelines for if you're feeling any kind of exposure, anything like that. If you have a slight immune system, you should mask, stay away from people, mask up, and take care of yourself. Try not to spread it around. So,
Should be noted that a good number, and you're probably aware of the healthcare institutions have gone to the mandatory for their staff and a strong encouraging advisory for their patients coming in. So it has moved in. I don't know if specifically to your question about Cape Cod, but I'm just reading that a significant number of the healthcare institutions are now mandatory for the staff.
Yeah, I don't know about here or not, but I know the Boston hospitals have been in contact with, and yeah, they're all masking up inside and certainly encouraging people when they're coming in,
Strongly
they're
encouraged.
retesting.
Right.
Okay. There is a new variant out there. It's JN1. If anyone comes across it, reading, hearing about it, and that's sort of skyrocketing across the country, in fact.
Infectious than the others.
Yeah.
You know?
Yeah, vaccine seems to be working for it. The NIH is now recommending that if it's been 6 months since the last vaccine, then it's time to get revaccinated. And certainly I encourage people to speak with their health provider. And certainly people who are at greater risk for progression of illness, whether it's someone over 65, people, as you mentioned, immune system problems, people with obesity, diabetes, that they're in greater risk. Once again, that's what the vaccine seems to be very good at, is preventing progression and people ending up in the hospital and increased risk for mortality.
I did also read that most all insurances cover the vaccines, all 3 phases of it. So they can go CVS, your local providers and stuff like that, Walgreens. They can set up an appointment. It's quick and easy. 10 minutes, you're in and out.
Okay. Anyone else? Okay. Any new or old business?
Well, I would like to let the board be aware that the plastic in the community listening to the plastic water bottle ban, again, a citizen's petition that was put at the town, at the a town meeting that took effect January 1st. We worked hard to inform retailers and consumers, residents to adjust their buying habits so that, again, individual, less than a gallon, non-flavored water bottle, non-carbonated are no longer available for sale in the town of Yarmouth. But we're still finding that, again, it wasn't a hard stop on January 1st. There's been some question about alkalinity, balanced drinks, and that's just the pH that falls within the regulation. But I guess distributors have said, no, this is allowed. So there's going to be a learning curve, and I expect you will still see them. I think the big retailers, the Stop and Shops, the Shaws, things of that nature, because they're able to move inventory across. And we're trying to be understanding, we'll say that, in compliance. We don't be punitive, although there is capacity for us to fine. We certainly don't want to do that. We want to educate. So in some cases, Phil, Barry, myself has simply said, just don't refill, don't restock some of the smaller bottles, go slower, exhaust your inventory, but don't replenish. So the community may see this, some vendors, retailers may say, gee, I don't have any, but I saw someone up the street. It's going to take, compliance is probably going to take another 3 weeks. It could even take the whole month of January, but we're determined that we will full compliance. But it's just compliance is going to take some time. We want to have a working understanding. And again, not to be punitive, to educate. We drop off the citizens petition, so they are aware. One of the things that we did find when we send out our applications, many a times, the big franchise stores, CVS or otherwise, it goes to the corporate office and doesn't make it to the local, branch down on 28 or
Right.
Station Ave or what have you. I just use them as an example, but there are others. And we send the applications with all the information highlighted for them to educate. We assumed everyone's going to get that email. Well, we shouldn't assume that. So it's going to take a little bit of legwork for us to go in one by one to make so they do understand, and we'll work within reason. We want to have a working, if they show a good faith effort, we will work with them. But the intent of that citizens petition by the community's vote was that there'll be no more single-use water bottles to be sold in Yarmouth, and we will have that in compliance. But we're just going to ask for a little understanding that it's going to take a little bit of time.
Shaw's had a notice on the door when I went in this evening
They did.
stating that in the town of Yarmouth, there's not permitted to sell less than a gallon
We're-
of water.
So it's getting through. And it's a difficulty. It's a disruption for some folks and certainly for retailers as well. But it's not a hard stop on January 1st. That's all.
It's just another great example of how the health department, the Board of Health is really trying to support small-time vendors here in town, supporting business, okay? Recognizing the problem it is for the store owners, and we're trying to support them.
Right. Yeah. It's a challenge.
I have a point also I've been discussing with Phil. As soon as we get everybody acclimated to not selling the single-use, non-flavored, non-carbonated waters, all of our seasonals are going to open up. So it's going to happen kind of again.
Right.
So Phil and I have discussed when he goes to do his pre-openings for all of his, for all the seasonal restaurants and resorts, that's one of the main things he's going to do is emphasize the regulations again to
Good.
them.
Right.
Because a lot of them be like, oh, I was in Florida all winter, I didn't get the emails, or I didn't know. So we're pre-planning for the seasonal businesses to help them out.
Right.
As well as the customers, they're going to be coming in July on the way to the beach to pick those items up.
Yep.
And so there'll be some issues there as well.
I did want to just mention something from the RAC meeting this evening.
Oh, great.
There will be a letter going out to businesses and residents involved with phase 1 of the project, asking them to fill out a form indicating where they'd like the sewer connection to go on their property. It doesn't mean that that's imminent. it's going to happen immediately, but they're just trying to kind of get ahead of the game and giving residents and businesses the opportunity to indicate if they have a preference where the sewer line would go, in case maybe they're thinking of putting in a swimming pool or doing something that might have, made a difference in terms of where the sewer connection's going to go. So in case you come across any folks that get that letter and that request for information, you'll know what that's all about.
Would that be available at the DPW then? That information be available through the DPW?
Yes, they're the ones that are going to be sending the letter out,
Okay.
DPW. Yeah,
Perfect, thank you.
The office gets inquiries on a regular basis.
really.
Where
yeah.
am I
Yeah.
on the, not so much where your connection is, but where am I in the contracting process? Phase 1, phase 3, I'm in phase 3 of contract 1. What does that mean? Because they have to then make a financial decision.
Sure.
And rightfully so. And we certainly want to bend in the direction of being helpful so that they do understand. A lot of times we do, as Barry just said, we refer them down to DPW to give the best estimate as to what the time frame will look like, and that's it's
Right.
pretty loose. But I think but that's encouraging that they're asking where they want the connections.
But the wastewater treatment facility hasn't been built yet. I mean, the contract bids haven't even gone out yet on it. We don't have permitting in place yet for it. So, this is down the road, but there are things that can be accomplished beforehand so that people are ready when we get the word that we can
No.
proceed.
There's a reason why big projects don't happen because they're really hard to do.
Yes.
Big projects like this are very big.
hard.
There's a lot, exactly right. But you know what? Yarmouth has stepped forward, the town,
Yep.
and to a large part, the selectmen, the RAC group, our town administrator, they've come forward and it's going to move forward. It's not linear. It's going to take a little bit of time and a
Exactly.
number of different
Yep.
things.
There's a new podcast. I haven't listened to it yet. It's called, I think, The Big Dig.
Oh, it's excellent.
So, yeah, okay. So in reference to big projects and how there are issues sometimes.
Incredible, isn't it? The
Yeah.
things that went on with that project.
Sure.
Incredible. The
Yeah.
politics, the personalities, the money, just, yeah. It's amazing. So, yeah, it did make me think about this project because, this project that we're working on with the wastewater treatment, it's going to go well beyond my lifetime.
Sure. It's a generational project.
Yeah. I
Sure.
mean, it's,
But the other part too, then we have the complexity of we're a tourist community, right? So from Memorial Day to Labor Day, there won't be any activity.
right.
So, but to the point that big projects, it's hard to move into implementation, right? And to execute.
Yep.
And that's why a lot of things get kicked down the road because it's just so big. Yeah, we don't want to tackle that right now. I do have another point of new business,
Sure.
and it's with some sadness that Erica Polite has put in her resignation, and at the end of January, she is going to be moving on from her position here at the Board of Health. But her dedication, as she has served the board for 3 years now, probably more. Erica, your dedication, attention to detail, loyalty, all of this, these Board of Health meetings, please know she's the one that's putting these together, making so much of this happen. In addition to the housing, she does the Title V. She supports the health office in so many ways and does it with a smile. And I don't know if any of you saw the other part that Erica does is she brings an excitement to our office with, you see the festivities. I don't care it's 4th of July to Thanksgiving we look like Macy's, our office, decorations everywhere. And that's an intangible that I don't even know that we can replace. Erica, I'll let the board talk, but we're going to miss you. And, but this is your last Board of Health meeting.
But Erica, we're just getting into the interesting stuff with chickens.
And eventually the turtles.
You can join the board. There you go.
Yeah.
Be a board member.
Yeah.
I can just say, I'm really disappointed. However, positive thing sometimes in life is you'll be navigating, exploring other things, which is good you know, for all of us. From our standpoint of view, at least mine here on the board, what I've always been impressed with, nothing seems to faze you. You deal with it, because there's some craziness here. Things don't usually work that smoothly. Nothing serious, but that's how it is. And it does, you seem to ride it really well, wherever it's going. We're trying to figure things out. That's, I think, what has most impressed me. You maintaining that and also all the detail behind it that a lot of people aren't aware of. So thank you.
Thank you. Do you know what you're going to do? No, no, still thinking about it? Yeah, well, good luck with it. Good luck.
So she'll be with the health office through the end of January. But because the way the calendar falls, this is the last time she'll be supporting you at the board.
Are you going to give your parking spot to anyone? This is really when life here, at least I'm from New York. I live in New York City. So this is really the important issue.
It's like a smoking retail license, right?
Absolutely invaluable, depending upon your spot. So one of the things I just want to mention is, you know, this time of year, everything's pretty bland and colorless, and just, we wanted to correct that a little bit. And that is, we have something for you that's got some color in it.
Right here
Okay?
for-
This is for you. Okay. And it comes with some literature. There's no quiz, there's nothing like that. Here you go. Okay. Thank you for your services.
Thank you.
Thank you.
Thank you.
Yeah.
Sorely missed. Sorely missed.
Thank you.
She also got a wonderful going away party for our former director too, for Bruce, together.
That's right.
So she's definitely party planner. Look into that as the next one.
A lot of destination weddings here. I mean, this, okay.
Thank you, Erica. Sincerely, all the work you've done. Truly wonderful.
Do you feel any healthier for having been the board secretary?
You sit there with a mask and, yeah.
She's learned to mask.
That's right.
You don't have oxygen on, so this is a good sign. You survived it. Stay healthy, all right? Best wishes.
Stay in touch too, huh? Yeah. That'd be nice.
Okay, Jay, any other new world business?
Don't have any other.
That's number 6. Hey, guys, look at this clock. We're really, okay. So number 7.
Time, ahead of time.
Someone want to address item number 7 for me here?
I will move to adjourn.
Second, anyone?
Second?
Okay, all in favor, say aye.
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 Meeting's adjourned. Thank you very much, everyone.